Hi, my name is Katelyn Reed. I'm with Thriving Minds. I'm the Selective Mutism Program Director. Go ahead. You can
Oh,
introduce
hi.
yourself.
I'm Dr. Aimee Kotrba. I'm the owner of Thriving Minds and also treat kids with selective mutism.
Yeah, so we realized that the coronavirus, this outbreak, this pandemic has impacted so many of us in so many different ways. And we also realized that there are some special considerations for our clients and their families, those impacted with a diagnosis of selective mutism. And so we wanted to kind of give you a quick introduction to the services that we're providing specifically for families with selective mutism during this time. We realize that these services are in many ways more important than ever because we have a lot of our clients who have had a very abrupt end to their school year, families who are hoping to see continued goals being achieved, had aspirations for the end of the school year, and those have all kind of very, very quickly been paused. And so we know that there's this sense of need to keep up with exposures and to prepare adequately for the return to the new school year, I guess the current school year or the new school year, whenever that might be. So we wanted to offer this quick summary and go ahead.
So one of the things that we continue to do is treatment as usual as anything is right now. We are offering telehealth for families who are seeking more longer term or continued weekly treatment. Some of the great things that have happened recently are that we as practitioners are getting better at figuring out how to do really effective treatment for kids with selective mutism via telehealth. Some of the other good things are that teachers now have a little bit more availability to do the sliding in or fading in technique with kids. We can help prepare them better for going back to school, whether it's this year or next year. And there's a lot of regulations that have been lifted for families who are even out of state. Some insurances are waiving copays and deductibles. So this is a really, really good time to get potentially free or reduced cost treatment for families who have insurance coverage.
Definitely. One of the other services that I'm specifically offering is an online classroom. So some of the feedback that families have been giving us is that their children have been tasked with doing online classrooms through their school. And of course, no surprise to anybody, children with selective mutism are struggling with this, maybe more so than their counterparts. And so I wanted to give kids and families an opportunity to practice kind of talking under those types of talking situations, like what is the new norm for schools right now, and that's an online classroom. Mm-hmm. So I wanted to design a program that would teach kids a little bit about anxiety, a little bit about coping skills. Those are our lessons, if you will. Obviously, the main focus here is on practicing using your voice in those types of situations.
Mm-hmm. For those families who have maybe already had treatment as usual and need continued consultation or ideas or strategies, we do offer 90-minute consultations. These can be for families that are local to us. And there's also some indication that psychologists are going to be able to treat across state lines right now. So we can offer consultations even to families who are not in the state with us. But this is a good opportunity maybe for families who have done intensives or treatment at other places and just sort of need kind of new ideas about how to manage exposures and brave practices during this strange and unprecedented time.
Mm-hmm. Or just simply a boost.
Mm-hmm.
And because we have some of those regulations being lifted right now about interjurisdictional practice, it's I think probably a great time to pursue that or to learn if your state and our state have that kind of reciprocity, such that we'd be able to provide that type of service.
And we can, if you're interested in doing that, you can just call or email us and we can look at your state and find out if that's something that we can offer to you pretty quickly.
Definitely. Yep, definitely. And I think the other piece is that that's changing almost daily. So states that we had states that we had previously thought we weren't going to be able to work in via telehealth services are now becoming more and more flexible with time. So that's good. I wanted to also really quickly offer some information that certainly I do intensive style treatments. So where families come from kind of all across the country, all across the world for an intensive dose of treatment for 1 week for almost 20, 25 hours during that course of that week. And so certainly the families who were scheduled to do so in this spring timeframe are electing to postpone those services in collaboration with our team here. It's gonna be really hard for us to do that service justice when we can't go anywhere. That being said, I am still offering intensives. Once it's safe to do so, I anticipate things will be moving fairly quickly in the summertime. It's usually a busy time of the year for us with intensive style services, but I wanted to also let you know that that's something we are more than happy to kind of talk with you about and potentially schedule for the summer or the fall seasons.
Mm-hmm. I think it's going to be really necessary to have these intensive services, and also the camp that we offer, Confident Kids Camp. Kids are going to be out of school for an extended period of time, much longer than usual. And I think that having some way to transition them back into school and prepare them for those brave practices that they're going to need to do at school is going to be more important this year than potentially ever before. So in that vein, we also have Confident Kids Camp that's coming up at the end of July. We expect it to run as usual. And we have 10 slots remaining right now. A lot of the slots that we have are for kids who are 4th grade or older. So if you have kids who are 4th grade or older, up into, what's the cutoff age, Katelyn?
So 9th-ish grade.
9th-ish grade. So 4th-ish grade to 9th-ish grade. And you're looking for an opportunity to jumpstart your kids back into the school year successfully next year after this extended break. Give us a call and let us know. I know that those slots are going to fill up really quickly, particularly after some of these regulations have been lifted. So now is a really good time to reach out.
Yeah, and we're I guess to add on to that, something that's another consideration here is our teen program. So we're one of the few programs that offer something that's very specific to teens. And so those who are 7th, 8th, 9th, ish grades, we'd be happy to speak with you further about whether that would be a good fit for your child. We have a really tailored kind of treatment program that's specific to their developmental needs, their educational style, their exposure kind of concepts. And then the last thing that I think we wanted to offer to you all is that we are planning on, within the next couple of weeks, running a teen social hour, teen and tween social hour. Just kind of knowing that those types of opportunities to socialize are more important than ever, both in the kind of scheme of this model of exposure therapy, practicing so that way we feel more confident and more fluent, but also just because we're all socially distant from one another right now, we realize that many people are just needing those types of opportunities to stay sane.
We're physically distant, but we really don't need to be socially distant. In fact, this is a great time to practice the socialization.
Yeah, so one of my colleagues, Dr. Becky Thompson, will be offering a teen social hour, and so more details to be coming on that. So this is, if you haven't already done so, this is a great time to follow our clinic on Facebook, because this is where most of this information will be updated. So we're just really mindful and respectful of the fact that there's a lot of need for these types of services right now. And we're just trying to kind of offer a robust series of practice opportunities that meet your child, your family's individual needs. So thanks again for sticking with us. And we hope that, you hope that something seems appealing to you, that you've learned something at the very least. And reach out to us if you have any questions.
All right. Thank you.